We start with a new topic, enuresis and incontinence. Enuresis, also known as nocturnal enuresis, indicates an involuntary discharge of urine. That is, the person passes urine without realizing it. This usually happens at night to children while asleep. Enuresis must not be confused with nocturia, that is, having to get up frequently to urinate during the night. Incontinence means inability to control the voiding of urine. The urine is passed involuntarily. The person involved knows he or she is doing it but cannot hold it back. There are four main types of urinary incontinence. First is stress incontinence. Urine leaks when coughing, sneezing, laughing, exercising, or lifting something heavy, which causes increased intra-abdominal pressure. Second is urge incontinence. The patient experiences a sudden intense urge to urinate followed by an involuntary, sometimes abundant, loss of urine. It may occur during the day and throughout the night. Third, overflow incontinence. Frequent or constant dribbling of urine is reported when pressure on the bladder increases. It may be due to bladder outlet obstruction, such as benign prostatic hyperplasia or an atonic bladder in diabetes, stroke, or multiple sclerosis. Fourth is functional incontinence. Behavioral changes, physical or mental impairment are observed even if the urinary tract is functioning properly. A patient may experience more than one type of urinary incontinence, the so-called mixed incontinence. Problems of urinary incontinence can be associated with severe diseases such as bladder cancer and Parkinson's disease, in case of urge incontinence, or spinal cord injury and multiple sclerosis in case of overflow incontinence. Therefore, it is important to make a diagnosis from the perspective of Western medicine and determine the causes of incontinence to exclude any underlying disease. Prevalence of incontinence increases with age. Quite often, elderly patients tend not to report symptoms unless specifically questioned because they feel embarrassed and wrongly think incontinence is a normal part of the aging process. In mild cases, a slight incontinence is relatively common and it is seen in urinary syndrome and interstitial cystitis. Now let's go to etiology. First is weak constitution. This is a cause of nocturnal enuresis in children. Constitutionally deficient kidneys are unable to control fluids and fail to provide chi to the bladder. This results in nocturnal enuresis. Shock. Prenatal or perinatal shock in children can be a cause of nocturnal enuresis. This can be observed in a bluish color on the child's forehead. The natural decline of qi occurring with aging may cause incontinence in old people. This is due to a decline not only of kidney qi, but also of lung and spleen qi. Excessive sexual activity in men weakens kidney yang and may lead to inability of the kidneys to control fluids and therefore to slight incontinence. The persistent strain caused by a chronic cough may lead to incontinence in a mechanical way from strain on the bladder and in an energetic way from deficient lung qi not controlling the bladder. The weakening of the kidney energy occurring in some women after childbirth may cause a slight incontinence. Thank you for your attention.